My name is Ivy Elkins, and I live in the Evanston area in Illinois, just outside of Chicago, with my husband of 26, almost 27 years. And I have two boys who are in college. One is 21 and a junior, and the other is 18 and a freshman. I was diagnosed a little over 8 years ago with stage 4 EGFR positive non-small cell lung cancer. Prior to my diagnosis with stage 4 lung cancer, I actually had visited an orthopedic oncologist because I was diagnosed due to basically a problem I was having with my elbow, which they initially thought was an issue due to a growth on the bone. Once I had a biopsy on the mass that was in my elbow in the bone, they realized that it wasn't a benign growth and it didn't originate in my bone, and found out that it was adenocarcinoma. So they submitted my sample for reflex biomarker testing to see what could be found. And at the time, they were just testing for EGFR, ALK, and I believe KRAS, although in later biomarker testing rounds, I was tested for hundreds of different biomarkers. When I found out that I had an EGFR positive mutation, completely changed my treatment journey. I found out that I had the mutation before I had started any treatment. So instead of a one-size-fits-all chemotherapy, I was eligible for a specific oral targeted pill to work against this EGFR mutation. And that's what truly has allowed me to do so well, to be doing so well over 8 years later. Since I had fantastic responses from the EGFR targeted therapy, I was able in 2020, just 2 years ago, to have surgery to remove the upper right lobe of my lung, which was the area that had my primary tumor and was the only area that I still had identifiable disease. So I am currently considered to be NED, to have no evidence of disease, which is something I never would have imagined when I was first diagnosed. So there is tons of hope that can be provided as a result of biomarker testing these days, and so many discoveries and improvements in research that are taking place. It's really important as a patient, if you're told that you're going to have biomarker testing, that you learn a few more additional things, such as, are you having biomarker testing through blood? Are you having biomarker testing through tissue? How is that biopsy going to take place? And finally, probably most significant of all, is which biomarkers are being tested. Because sometimes, only a few biomarkers are tested for, and that could be a problem because something that could really, really change your treatment trajectory could be missed, that wouldn't be missed if you had a more comprehensive biomarker test or next generation sequencing. Research is the key, and I wouldn't be here if it wasn't for all this research.